In women, Synarel Spray, non-aerosol is used to treat a condition called endometriosis, where the tissue that normally lines the inside of the uterus grows in the wrong place. This medication helps to decrease the abnormal tissue and also the symptoms of endometriosis such as pelvic pain, painful menstrual cramps, and pain during/after sex. It is also used by children to treat a certain type of early puberty called central precocious puberty, gonadotropin-dependent. It helps to slow the bone aging and height growth rate so that both are near normal, and it helps to stop or reverse signs of early puberty such as breast growth in girls and growth of sexual organs in boys. Synarel Spray, non-aerosol is similar to a natural hormone made by the body called gonadotropin-releasing hormone, GnRH. It works by decreasing the testosterone hormones in boys and estrogen hormones in women and girls. The recommended daily dosage and the optimal timing for taking this medication should be consulted with a healthcare professional. Before you start using Synarel Spray, non-aerosol, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. When using the spray for the first time, follow the instructions for test sprays in the air to make sure the spray is working properly. Blow your nose gently before using this drug. For young children, you may need to clear the nose with a bulb syringe. Use this medication as directed by your doctor, usually twice daily, about every 12 hours. If you are using more than one spray at a time, wait 30 seconds between each spray. Avoid spraying this medication in your eyes and try to avoid sneezing during or right after using it. Follow the detailed instructions for cleaning the spray tip after each use. The dosage and length of treatment are based on your medical condition and response to treatment. It is important to continue using this medication exactly as prescribed by your doctor. Do not skip any doses and use it at the same times each day to help you remember. Do not use the nasal spray bottle longer than recommended, even if there is medication left over, and make sure to get your medication refills a few days early so that you will not run out. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of side effects. If you need to use a nasal decongestant spray while using this medication, wait at least 2 hours after using this medication before using the decongestant. When you first start this medication, worsening of symptoms may occur. These symptoms should get better after the first month of treatment. Tell your doctor if your symptoms do not get better or if they get worse after 2 months of treatment. Children using Synarel Spray, non-aerosol may experience nasal irritation, hot flashes, or vaginal discharge, while women may experience nasal irritation, hot flashes, headaches, decreased sexual interest, muscle pain, vaginal dryness, acne, or decrease in breast size. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to note that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. Be sure to notify your doctor right away if you experience any serious side effects such as mental/mood changes, such as depression, thoughts of suicide, mood swings, aggression. For women using this medication, it's important to inform your doctor immediately if you experience abdominal/lower back pain, bone pain, fast/pounding heartbeat, numbness/tingling of arms/legs, or eye pain. In the event of very serious side effects, such as seizures or symptoms of increased pressure around the brain in children, seek medical help immediately. These symptoms may include nausea/vomiting that doesn't stop, severe or persistent headache, eye pain, vision changes, or ringing in the ears. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Before using Synarel Spray, non-aerosol, it's important to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have a history of abnormal vaginal bleeding, smoking, daily alcohol use, osteoporosis, polycystic ovarian disease, high cholesterol/triglyceride levels, seizures, or mental/mood problems. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and herbal products you are using. This medication should not be used during pregnancy, as it may harm the unborn baby. Women should start this medication between days 2 and 4 of their period. It's also important to note that although periods and ovulation may stop while using this drug, it is not a reliable form of birth control. It's best to discuss the use of non-hormonal forms of birth control with your doctor. It is not known if this medication passes into breast milk, so it's recommended to consult your doctor before breastfeeding while using this medication. When using Synarel Spray, Non-Aerosol, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's important to note that this medication may interfere with certain lab tests, potentially causing false results. It's essential to make sure that lab personnel and all your doctors are aware that you are using this drug. Always follow your doctor's recommendations and consult with them for any concerns regarding drug interactions or potential interference with lab tests. If someone has taken too much Synarel Spray and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important not to share this medication with others. It is also important to undergo lab and/or medical tests, especially for children, to monitor their growth and bone age velocity while using this medication. Make sure to attend all medical and lab appointments and consult your doctor for more information. If you happen to miss a dose of Synarel Spray, Non-Aerosol, just take it as soon as you remember. But if it's almost time for your next dose, then it's okay to skip the missed one and just take the next dose at your regular time. Avoid taking double doses to make up for the missed one. It's important to note that girls and women who miss doses of this medication may experience vaginal bleeding. So, it's crucial to stick to the prescribed dosage schedule to avoid any potential side effects. When storing your Synarel Spray, Non-Aerosol, be sure to keep the bottle upright at room temperature, away from light and moisture. It's important not to freeze it or store it in the bathroom. As with all medications, keep it out of reach of children and pets. When it comes to disposal, do not flush the medication down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.